Hi, how's it
Hello.
going? We are today talking about, as Facebook slowly loads over here.
Yep.
Okay, now here
Here
we're
we
going on
go.
Facebook too. All right, what is going on, everyone? Welcome to this live edition of the Behind the Counter Show. For those of you who don't know, my name is Vince,
I'm
and
James.
this is James. Of course,
Yep.
James is a pharmacist, practicing a lot, focusing on functional medicine, in addition to being a retail and compounding pharmacist. And I am a personal trainer and nutrition coach. And today we wanted to talk about, hey, what's going on, Caitlin? Long time. And today, we wanted to talk specifically about some side effects of medication that you may not be aware of. So normally also we do this behind the counter show. It's kind of filmed after the fact. Then we release it. We thought it'd be cool, especially with everything going on. I don't know if you're aware, but there's this pandemic thing
Yeah, I know,
going
right?
on. So with everything going on in that sense, we wanted to get this a little more live and more interactive. So as we're going, if you guys have any questions, feel free to chime in and ask those questions. But we're going to talk about specifically at the beginning um, medication and some side effects that you may not be aware of just because they're just not as talked about mostly. And I guess
Right.
we'll start right there. So take it
Yes.
away.
So, for example, when you get a prescription, right, you will hear a lot of, well, this will make you drowsy, or this medication will possibly cause constipation or runs.
Right.
Those are very
Or
common.
maybe if you it's like a painkiller or something, possibly this may make you feel a little loopy or
Right,
whatever,
right. A
you
lot
know?
of those things don't drive after taking the medication. Those are all side effects, right, that can be caused by a certain medication you're receiving.
Right.
That's probably a very short term side effect that you'll be receiving right away as well. What they don't talk about, when I say they, it's actually on both ends, whether it's the pharmacist or the doctor.
Right.
When a prescription is being prescribed and dispensed, we generally do not take the time to talk about a possible nutrient that you'll be losing from taking medication.
Right. It's one of those things where even in my profession as a trainer, nutrition coach, it's even now more broadly being talked about these nutritional side effects. And I think that's for a few reasons. I think one, first and foremost, and as you guys have questions, that kind of stuff, feel free to chime in at any time. First and foremost, we're learning more and more about our gut and our digestive health every day. More and more studies are showing the
Right,
importance of that just because, I mean, think about it rationally, right? You eat something, what's the first thing that happens? It goes through your digestive system, we got to
right.
absorb the nutrients. So it's something that's we're learning more about that every day. So in turn, we're learning more and more about the nutritional side effects of medication every day.
Mm-hmm.
And I think also too, some of these side effects of medication, like we'll get into some examples here shortly, you may not actually even feel it necessarily because if you're not typically, when you're taking medication, usually there's some kind of underlying condition or something else that's going on. And if you are already not necessarily eating as, optimally as you should, you may, constantly kind of be feeling that fog, like here, a good way to put it is if anyone's ever tried temporarily to cut out dairy or cut out gluten, you may feel this fog all of a sudden lift. It's a
Yeah.
common feeling. I've personally felt it when I tried that. Not that I'm always perfect about doing it because we're all human, but when that fog lifts, you all of a sudden, wow, like I feel a lot less bloated. I feel better, And if you're constantly in that fog, even if other, side effects nutritionally may be there, you may not even actually notice them necessarily.
Right. Also, it's there's just too many variables.
So many
Um,
variables.
just I mean, one of the very common one that we will talk about. For example, when you take a statin medication that's for cholesterol, then you lose CoQ10 enzymes.
Hmm.
Now, yes, in the book, by the book, yes, you may lose it, but how does it really affect you? And that can vary. That can vary between whatever possible the conditions that you have,
Right.
how your nutrition is. There's just so many different variables too. That's why it's so difficult to pinpoint one and just say, here, when this happens, this happens. It doesn't really work that way.
Right.
That's why you have to ask more questions, utilize your healthcare professionals, and really dive into these questions about it.
Sure. And a lot of reasons too, right? Like sometimes when something's prescribed by the doctor, a lot of times we just, okay, well, we'll just take it. So you just kind of assume it's good or assume it's healthy. But truthfully, and this is coming from, a pharmacist, medication in general, it's processed in the same way, alcohol and everything else is processed in
Right.
your liver, So it's something that your body has to break down and absorb. And, the truth is taking less medication, the better. So when we're constantly being like, well, I need this though because, my blood pressure is too high or my
Correct.
cholesterol is too high. And
Right.
hey, especially when it comes to those immediate situations. Something's got to change, but ultimately, in order to do some of those things, that it needs to go along with diet, exercise, and all of that good kind of stuff too.
Right.
Medication is not, if you're taking it every day for the rest of your life, chances are, and anecdotally or maybe just kind of thinking about it rationally, there's probably going to be some side effects of taking something like that that you may not realize or may not want, right?
I think how we think about medication kind of has to change our
Yeah.
perspective on it. A medication, a pill, is not a solution,
Yeah.
right? At one of the conference that we went, this was actually a great example. Our lecturer gave us. Like when you are young, or if you're talking to a child, right? You don't talk to them and you don't say something like, "Well, in order to be healthy by age of 35, you're gonna start taking statin." You don't
Right.
talk about it that way. We said diet and exercise, eat healthy and all that. That's the correct way of approaching your health and solving your problem, not taking one pill, because it's not a solution. And
Right.
unfortunately, more than that, it actually harms you. It's a give and take. When you take a medication, sure, it can lower your blood pressure, right? But at the same time, it's gonna, you're gonna lose vital nutrients, such as, for example, water pill. I'm sure a lot of people take water pill. When you take that, you lose a lot of nutrients, potassium, magnesium, and so forth. And I'm sure a lot of people feel the side effect of it, but they cannot pinpoint where that's
Right.
coming from.
Right. And yeah, I totally agree with you, Caitlin. Thank you for that comment as well. But all right, let's get into some specifics here. So we promised some specific examples, and there are
Sure.
some, if you come to our pharmacy, you hear us talking about all the time. We talk about probiotic and antibiotic all the time. So we'll skip that one because that's something that I feel like we just belabor that one to death at this point. But it's an
Absolutely.
important one
It
too.
is important, and antibiotic is one of the medication that actually causes you lose a lot of different nutrients from antibiotic as well.
Right.
Just probiotic and the antibiotic is just so prominent out there, and but there are other things that you will lose from it as well. At the same time, for example, if any of your family member or yourself even take blood pressure medication, cholesterol medication, diabetes medication, steroids, blood thinners such as maybe aspirin, I mean, that probably would consist about, I would say, 90% of the population
Yeah.
of our country at this point are probably one or more on all these antipsychotics, antibiotics. Probably we are probably almost at 100% right now. Now, when you take these medications, and especially if you take it for a long time, you will lose vital nutrients. And
Phytonutrients mean nutrients from plants, typically.
right, some examples are potassium, magnesium, calcium, typical ones that you would think of that you can when you go to a vitamin place and then you look at on the shelf. Those things, all the supplement, you're probably losing when you take medications.
So why does that matter? What do some of those things you're talking about losing magnesium or potassium, what the heck does that mean and why the heck should I care about that?
Right, it's actually pretty dangerous. For example, water pill, right? That's usually the first line therapy for a lot of blood pressure. If you have a high blood pressure, and then if you take that for a long time, you can lose potassium. And if you're low on potassium, it actually negatively affects your heart a lot of times, along with your muscles, right? So they came up with another water pill that's potassium sparing, diuretics they call it,
Okay.
because they know losing potassium is big
Not
deal.
good.
Not good, right? However, even with that, does that solve the problem? No, you still lose magnesium and other things as well. So, magnesium is one of those things where you may not notice it right away, or may not be a big deal in the beginning. And low magnesium can be associated with so many different things, right? If you need a bone support, what do you take? Magnesium. If you have a muscle cramp, what do you take? Magnesium. If you have difficult time sleeping, what do you take? And again, magnesium.
Even pooping too.
Absolutely. If you have a problem, have constipation, what do you take? Magnesium. Magnesium is so vital in our body.
Yeah.
And not many people really think about it, or they believe whatever condition that they have is causing fatigue or all these effects that we're
Right. And
getting.
they don't necessarily realize that it's actually possibly a side effect of the medication, like James alluded to at the
Correct.
beginning. And if you guys have any questions as we're going, feel free to chime them out, and we'll answer them as we go as well. But kind of like James alluded to in the beginning, it's so complicated looking at these things, and really to get a full picture of what's going on and what's truly being depleted, what's whatever, you would need to do a full, blood work, all of that kind of stuff, which, let's be realistic, is not usually feasible, nor is it, practical. So some typical things, for he talked about the water pill, blood pressure, that kind of stuff. If you're taking those things, you should be increasing your magnesium intake in particular, among some other things as well.
Absolutely.
But if we're talking about magnesium specifically, you can, of course, always do that through supplementation. Something that not a lot of people know, there's a lot of magnesium oxide supplements out there, nowhere near as well absorbed as glycinated forms of magnesium. If you have questions about that, just, comment, ask us. We can help you talk through, find a better brand. But the magnesium oxide ones in general are so much, I think it's 90% less absorbed than the glycinated magnesium.
Yes.
But if you're trying to get more in your diet as well, there's plenty of other things in your diet. Grains, seeds, avocados. I love avocados, legumes. I mean, legumes, beans. They're especially if you're vegan, vegetarian. I mean, you almost can't be that without legumes or beans because it's just such a well-rounded legume. But so those are some examples of how to get those in your diet naturally as well. What else you got?
So basically, that's what exactly Vince just pointed out. We're not also trying to solve a problem within the problem.
Sure,
right?
Point,
We're
fair
not.
Point.
Supplement is definitely an easy way out a little bit. It's just that, but it does not beat healthy diet and exercise a lot of times. And as Vince mentioned, it's not practical. But at the same time, you really have to ask those questions for yourself because, as I mentioned in the beginning, it's very difficult to pinpoint your problems that you may be experiencing if you don't ask these questions. It can be from various different conditions. It can be from medications. And then, when you actually, dig a little bit and then try to research some about this, you get very, very controversial, studies and observational studies out there. And that's because, and again, there's just so many variables. And what they are actually, emphasizing and, putting as a control are all different.
Sure.
But in the long run, it doesn't hurt to ask about it, and there's a huge possibility that they're the problem.
Sure.
So, we just talked about the magnesium. So some of the things that you may feel if you're low on magnesium, muscle cramp, very, very common. Insomnia, anxiety, depression, osteoporosis, bone loss basically, right? So, and believe it or not, some studies suggest that 75% of our population are actually low. They're at lower than recommended level of the magnesium level.
Sure.
So that's very important.
What are some other drugs? So we talked about the water pill. What else we got? I know metformin, CoQ10 is another one. So what is CoQ10 and what drugs kind of deplete CoQ10 in our bodies? Why should we care about CoQ10?
So CoQ10 is basically, it helps to create energy. And there was actually a Nobel Prize given to some guy. I don't know, I forgot the name of it, the guy, but for actually figuring this out, that CoQ10, is very vital to create energy in our mitochondria at cellular level.
So not energy from oh my god, caffeine pill energy from a cellular level, right? Then, creating ATP, which is energy.
Right, but eventually leads to that. Yes, we have the power to actually,
But it's functioning at a cellular level too. Right. Every cell needs that to go about its daily functions, what it needs to do, essentially.
So, for example, statin, as I mentioned, beta blockers, that's also used for blood pressure to by lowering your heart rates. That also, you can also lose CoQ10 from that as well.
If you want to get into the science of it, the way it actually works for cholesterol medication, at least, is in the process that is actually going to block your body's ability to create cholesterol. In that same metabolic chain, it's actually blocking your body's ability to create CoQ10 as well. So that's why typically we recommend supplementing with CoQ10. And actually, I think it was Pfizer who someone had a drug patent on the statin with CoQ10 as a joint product initially when it came out.
It just never pan out. But now here's the thing though. So a lot of times when you take a cholesterol medication is to prevent stroke, right? Heart attack, or God forbid if you already had one, a lot of doctors will put you on a statin for that reason as well. Well, guess what? Now statin lowers CoQ10. CoQ10 actually helps LDL, which is a bad cholesterol, so not as bad.
Right.
Now, but if you're actually losing CoQ10 from statin, there are some studies possibly suggest that you're actually possibly increasing because of a low CoQ10 level can influence your chance of getting heart attack or stroke. And that's pretty serious because you're taking the medication obviously to prevent that from it, and at the same time it can cause the problem by the other route.
Sure.
CoQ10, you know, it can even go up to like 50% decrease from a statin medication. So, it can cause, so low level of CoQ10 can cause stroke, heart attack, fatigue, muscle cramp. And now I'm going to talk about the muscle cramp a little bit because it's one of the very serious side effects of statin medication that can cause muscle cramp. And a lot of times, um, if you experience that, doctor may actually stop you from it or change the medication. And supplementation of CoQ10 may or may not help with that muscle cramp. Now, the funny thing is, it really depends on what study you look at.
Sure.
So it's not 100% proven the fact, oh, yes, 1 plus 1 is 2. It doesn't work that way. However, it doesn't hurt, especially if you're taking multiple medications. Or if you're taking, a metoprolol, for example, which is a beta blocker, and atorvastatin. And again, a statin. That's 2 right there already. And generally, I would recommend at least 200 milligram of CoQ10 to supplement yourself to balance the counterattack from it.
Sure. All right. So we talked about water pill. We talked about magnesium, potassium. We talked about statins, beta blockers, and we talked about CoQ10. What about some of the diabetic medication, like the metformins or the
Sure.
blood sugar medication?
Metformin is a very common one. If you take metformin for a long time, 3 to 5 years or longer, you can lose a lot of vitamin B12. And if you heard of vitamin B12, is and again essential for energy. If you go out there and get an energy drink, it's packed with vitamin B12. That's basically what they're giving you, plus caffeine.
Right.
Some of them, right? But that you lose a lot of vitamin B12, and then again, that's not just for the energy. Also, it helps with anemia, and things like that. And on that note, for example, not vitamin B can be lost by so many different things, different drugs, oral contraceptives. A lot of ladies take oral contraceptives for whatever reason, directed by the doctor, and at the same time, when you take those, it eats up your. I kind of call it out, say it's eating up your vitamin B complexes.
Sure.
Whether it's folic acid, which is, and again, folic acid is one of the family of vitamin B, B6, B12. Yes, and again, for someone who's digging a little deeper, there is more different studies stating otherwise on some of them, but overall, it is absolutely essential to, I think, to supplement yourself with vitamin B complex when you're especially on oral contraceptives.
So yeah, especially oral contraceptives, the metformin and some of the other diabetic drugs as well. And vitamin B12 again, it's energy, and B vitamins in general, that's what they tend to do. So if you're not supplementing, you definitely need to make sure you increase in your diet things like grains, meat, eggs, legumes. Again, everything's got legumes, or legumes have everything, I should say. So those are some other ways to get B and B12 specifically naturally from your diet. But again, that's why we typically recommend at the pharmacy to our patients who are, we're literally sitting there and dispensing this medication. We kind of feel obligated. Hey, just so you know, this is what's going on with your medication in your body. It's a side effect you may not realize about. It's something that, possibly your doctor may not have even talked to you about. So,
Right.
We feel obligated to share these kinds of things because medication has a lot of unintended consequences sometimes in our bodies.
Yeah, also, I mean, all these, I haven't talked about zinc yet, and the zinc is obviously good for immune support.
Sure. Especially right now, zinc is a very popular product. And if you guys have any specific questions as we're going, James is a pharmacist. We're here on Behind the Counter Live on Facebook and Instagram. Feel free to throw them out. We'll have some open-ended questions at the end, so if you have any general questions as well, throw them out now too, and we'll answer them in the last 5 minutes as we begin to wrap up. But yes, sure. Zinc.
Zinc, ACE inhibitors. That's also used for.
What is an ACE inhibitor?
ACE inhibitor is a lot of times used for to control your blood pressure as well.
Okay, another blood pressure.
Yes, and also water pill. Now, the problem, and again, we talked about magnesium, vitamin B, folic acid, zinc, CoQ10, all these, if you're low on these, overall, it can really cause weight gain as well because it can cause metabolic syndrome. It can link to the metabolic syndrome. Basically, metabolic syndrome meaning you have higher chance of getting coronary artery disease. you know, if no matter what you're doing, it seems like you're not losing that waist fat, right? Your waist size is still, for men, I think above 42 is considered um not good, right?
Sure.
Um and that can also be from, you know, lowering of low amount of your vital nutrients in your body from the medications that's supposed to help you.
Sure.
Yeah.
So what does zinc specifically do? You know, like I mean, you mentioned immune support. I feel like we're inundated with zinc these days, and you know, there's a lot of talk about it in the news and that kind of stuff. So what exactly does zinc do? And if you're deficient in zinc, why is that an
Number
issue?
one thing is your immune support. You can if you're low in zinc, you
Why
can.
is that, by the way, with
Well,
your immune support?
it definitely modulates your immune system.
And what does modulate mean?
Well, basically the way the zinc, how do I put this? So the zinc way the zinc like kind of, I don't say work.
Sure.
Right? It's I'm gonna try to figure out the better way of explaining this. Maybe we can put it in the comment a little later.
Yeah.
It definitely works at cellular level. You need zinc to basically emphasize your immune function, for lack of a better term.
Okay. Okay.
I don't know if you have any.
Well, what about like, you know, even like we talk about zinc lozenges in your throat, right? It kind
Well,
of prevents.
okay.
That's a little bit different
That's
than
different.
it works at a cellular level, but
Right. We did talk about that. Well, that's generally what we talk about: supplementing with yourself with zinc tablet by mouth versus lozenges, which lozenges to coat the back of your throat.
sure.
And a lot of times there are a lot of different studies out there states that that will slow down the replication of any virus. Very common ones are cold and flu viruses. So that's the reason a lot of people will supplement themselves with the zinc. And again, and again very popular with COVID. When COVID first hit back in March, April.
Similar with COVID too. I think zinc, correct me if I'm wrong, but that is associated with possible loss of taste or
Yes,
smell, kind of similar
if
to
you're low
COVID in
on
that
it,
sense as well.
poor wound healing, and that's all with the immune support, immune function.
Hair
issues.
too, right? I feel like I've
Yep.
heard about that for men specifically. I think for hair loss and that kind of stuff too.
Yes, also for men function.
Yeah, men function. Right there, you go.
That's if you're low on if you're low on zinc, take some zinc and see what happens. They do say
so.
that, absolutely.
You know, like we've talked about, there's a lot of different tests out there and ways to confirm some of these things, but it's important to know that if you're taking medication, sometimes there are some unintended nutritional side effects in those things as well. Zinc specifically, again, as I've mentioned like 50 times, in legumes. Legumes have everything. If you're vegan or vegetarian too, that's why, you know, actually B vitamins specifically too, for people who tend to be vegan or vegetarian, that's why B12, iron, some of those things. Yeah, men function, right? That's why B12 and iron, those things are recommended as supplements for people on specific diets or who have dietary preferences, restrictions, that kind of stuff, to take some of those things because they're not as common in plants. So it's just something to consider. Zinc is also in shellfish. People talk about oysters specifically.
Right.
Big oyster fan. You know, but unless you feel like going to a swanky restaurant, which is really out of the question these days for the most part, you know, that's why we typically recommend zinc in conjunction with some of those other products as well. Yeah, is there anything else you want to throw in here about nutrient depletion or other unintended side effects of medication in general?
You know, overall, what's more important is it's not just about the fact that you may feel tired.
Right.
It's not just about the fact that you may have some, you know, muscle pain. It's actually a lot more than that.
Yeah.
Overall, low amount of these vital nutrients may increase the chance of, you know, insulin resistance, which can lead to diabetes.
Yeah.
Stroke. You know, a clog of your vessels, which is what you don't want. And sometimes you take the medications so that you prevent all these.
Sure.
And it's having some counter effect with that. So it's definitely important to ask these questions. And maybe sometimes if you're doing all this and taking, you know, eating right and supplementation, you definitely need to test more.
Sure.
In order to really take this seriously.
Well, to your first point, I think that's one of the reasons why we do videos like this and talk about this in general. A lot of this, you know, is intended to be informational, and our goal at the pharmacy and with Gasper's Best is to empower you as patients to ask these questions. This is your health and your life. Own it. Take ownership of it. You know, there's some things that you should, you know, question and look into, you know, and this is, you know, why we're kind of here and sharing these things. And the other thing I'll add to that too is, you know, for a lot of people who, you know, be like, I don't really feel like taking another pill, or I don't feel like this. If you're going the supplementation route, you know, if you look at it rationally, yes, you probably shouldn't need to take some of those things, because if you were eating a full balanced diet of whole foods and moving around every day, yeah, chances are you're probably going to cover most of your bases on that. But the truth is, that's not a reality for most of us. And also, if you're on some of these medications that are causing these depletions, chances are you're definitely not doing some of those things,
Right.
because that could be part of the issue why it got there to begin with. That's not, an all-around statement necessarily. There's going to be different reasons for that, of course, but it's just something to keep in mind. And going along with anything we recommend, of course, obviously, dietary changes, lifestyle changes, that kind of stuff is all great too. But that's why we typically recommend, if you're going to take the pill, and especially if you haven't made some of those other changes, supplementing to at least deplete what is probably, or to at least replenish what is probably being depleted by these medications, is typically a good idea.
Absolutely.
Cool. If anyone has any questions, then feel free to chime and let us know. Oh, we do have a question from Patricia on Facebook here. So is tiredness a side effect of metoprolol?
Absolutely. And
And metoprolol is what, James?
metoprolol is one of the beta blockers
Okay.
that will basically lower your heart rate to control your blood pressure. Now, think about that. The way it works is that it lowers your, heart rate, which, and at the same time lowering your blood pressure. If your body was used to certain high blood pressure per se, right? And all of a sudden you're taking the medication to correct that, your body doesn't take it that way. Your body says, "Oh my goodness, my pressure is going down."
Mm.
Even though that's from bad to good, right? So your body can take that as definitely now I'm feeling tired because my heart rate is lowering down and my blood pressure is going down. That's just really for a short term of it. Um, Also, if you take it for a long time, and again, it can be because of the CoQ10, depletion, and there are other things that can be associated with that. So some way of kind of countering that, it can be various things. One, well, if you've been on it for years, let's try a CoQ10 supplementation. That's one. Two, maybe if you're taking an immediate release of the medication, maybe try to change to the extended release of the medication.
Mm.
That may help with some of the side effect with being tired.
And of course, that's something we would, discuss with your physician and all of
Correct.
that good stuff as well.
Yep.
Does anyone else have any other questions related to nutrient depletion, different medication and side effects, or anything else while we're standing here as well? Well, actually, we're sitting, but you know what I mean. Any other questions before we wrap up here? And thank you for the questions that we've got on Facebook and Instagram, and from Caitlin for the comedic comments on Instagram as well. Always worth a laugh. Carlo of the Forest on Instagram has promised dogs and don't see any. They're running around the pharmacy here somewhere. Not sure where they are right now. They are always up to mischief around here. But we'll make sure we include them. This is the first time we've gone live on this. We didn't want any of the destructive force that is the puppies here in the video knocking over the equipment we've got set up. But yeah, cool. So thank you guys for the comments, questions. Hope you guys enjoyed this first rendition of Behind the Counter Live. We'll actually be posting this in a post and on YouTube as well after the fact. So we'll share this. It'll be on our Behind the Counter page on GaspersBest.com. It'll also be on our podcast players after the fact. We're going to continue doing this once a month, every month, third Thursday of the month at noon. So it seems like we had some good interaction on Instagram and on Facebook, so that's great. We'll keep that up there. And if you have any questions, sometimes this stuff can obviously get personal, so feel free to shoot us a message. We'd be happy to jump on the phone and talk it through as well, if that's easiest. Or if you're local, stop by the pharmacy and happy to chat with you here as well. James, any last words? That sounds morbid, but that's not what I meant. Any final
No,
words?
good.
Cool. Oh, thanks for the comment, Marie. We appreciate that too. Glad to hear you found it useful. All right, yeah, sounds good. We'll see you guys next time. And any other questions or topic suggestions too? We're always looking for suggestions and topics to talk about. Let us know. And yeah, thanks for checking us out. We'll see you guys next time.